When Dan Egan lost his father to suicide more than 3 decades ago, it changed his life completely. At first, he didn't talk about it and pretended that everything was all right, but it wasn't, and he knew it wasn't. Fast forward to today, and Dan leads the Capital Region chapter of the AFSP and sits on the National Loss and Healing Council. We spoke about mental health today and how more lives can be saved. Dan, thank you so much for being here. We appreciate it.
Oh, thank you so much for having me, Dan.
Of course. So mental health, I feel like, is such a pivotal issue right now. I mean, there's just so much coming out of the pandemic, different traumas happening. I mean, politics, a lot on the board. How often do you hear about that in your work? I mean, you have to hear about it all the time.
Yeah, absolutely. You know, in some ways, it was kind of the one silver lining out of the pandemic is for a lot of folks, it was the first time they really experienced some of that anxiety and that isolation. Oh, yeah. And while we don't wish that on anybody, it helped to raise awareness. You know, and like you said, with the divisiveness in the country over politics, you know, mental health and suicide prevention is really the topic that I think should be able to help unite us, and we can all agree that we need to do better.
I think so too. I mean, during the pandemic, I think you're right. It was a time where a lot of people sought help because the pressures were just so intense. I mean, you had so many people out of work, kind of hopeless about their future. They didn't know what to do. One of the things that really comes down to this when we talk about mental health is the stigma of it. A lot of people don't get help because they're afraid to talk about it. What do we do about that?
Yeah, and, you know, and every time we talk about it ourselves, right? Like I've dealt with my own mental health issues as well as having a suicide loss. And every time you share your story, it kind of gives people permission to share theirs. Yeah. You know, and if we want folks to really, like we say, take our mental health as important as we do our physical health, you know, it really comes down to being willing to have those open conversations. And those of us who are outspoken about it, hopefully will help others be able to do so as well.
Yeah, I mean, I ask about stigma because I think the first step for anybody in terms of dealing with thoughts of suicide or self-harm is really just talking to somebody. I mean, guide me through it. If I'm somebody who's having these thoughts, it's a very crucial time to make a decision. What should I do?
Well, if you're, you know, truly in that crisis, which sometimes we know can be short, you know, first step, dial that 988, you know, or text it if you don't want to talk to someone. You know, since it's been shortened, we're just a little over the first year of implementation, and we've seen that the calls to the line have gone up 40%. But the amazing part is the text line. You know, the texts to 988 have gone up 1,000%. So it shows people are using it. You know, no matter where you are or when it is, there's always someone there who can support. You know, for some people, that crisis might just be over, you know, and it might pass. But for most of us, you know, we're going to need additional help and always speaking to a mental health professional. Now, that's where in some places right now we really run into struggles because there just aren't enough providers for the number of people who need help.
Well, so that's what I wanted to talk to you about.
Yeah.
I'm somebody who suffers from chronic depression. In finding a therapist, it's impossible a lot of the time. I mean, because of availability, because of their availability in terms of their time. You know, they're working 9 to 5. I'm also working 9 to 5. I can't just go in the middle of the day a lot of the time. That strikes to an issue that I think is much bigger than me and my problems. The mental health infrastructure in this state, I don't feel meets the demand that we have. And I'm wondering how you feel about that and what we could do about it.
Yeah, you know, I think what you say is completely true. You know, our state, and this is a little scary at times, might be one of the better states in terms of mental health infrastructure. Wow. So there's a lot of work to be done across the board, but we really need to find those ways, you know, for the private sector as well to incentivize folks into going to that profession. Mm-hmm. You know, for example, we have a very limited number of people who have diverse backgrounds who are, you know, so if you wanted to see someone who looked like you, shared a gender identity, you know, shared a religious faith, it would be, then you'd be in an amazing struggle. So that's one step, you know, and investing in it. You know, the governor invested $1 billion in it this budget season, which is great, you know, but then it comes down to how that money is spent. And that's really just the tip of the iceberg, right? Yeah. You know, mental health is almost constantly, we're in triage mode. So we really are dealing with crisis all the time. When you talk about what's the best way to prevent suicide, right now most people would say 988. Well, that's the equivalent of catching someone in stage 4 cancer.
Yes.
So the goal is to really move it back to where we're getting folks to see people, you know, see a mental health professional when you're healthy, so that you can build up those skills to deal with the crisis when it comes to it, so it doesn't reach a critical stage.
Exactly. Kind of like how I see my doctor for a physical every year when he wants to check me out. I mean, I think a little bit more than that regular. If I was going to see a therapist while I am mentally healthy, I wouldn't go just once a year. But
Right. But even still, when we talk about our preventive medicine, that physical is covered 100% by insurance.
Right.
A lot of the preventive tests to screen for cancer are covered at 100%. We don't have that as widely available for mental health. Maybe it comes down to, and again, this is me as an advocate, not me as a professional, but developing that mental health physical. Right now the doctors do have that sheet they'll give you sometimes. I don't know if yours does.
He does.
Where it talks about, and it's a 1 to 5, and that's always hard. But again, are they ready to hear that answer?
Right.
So, it's making sure that our primary care physicians are trained in how to deal with someone who might be in crisis. And then incentivizing people to go into the psychology, the social work field, especially communities of color and our underserved and marginalized communities, to make sure there's representation. The other thing that's a huge thing is youth. There, aren't that many state-run youth beds.
Yeah.
I've heard it from someone at OMH, and it's from like downstate to out to Ithaca or Utica. So in this area, if you were to have a child who needed inpatient, it's not available through the state, and it's very limitedly available through private.
And that's really just a funding issue, I'm assuming. More funding would lead to more beds opening.
Exactly. It's more funding. Obviously there'd be construction and build out and implementation and finding providers. Right. But, ultimately a lot of it does come down to funding and raising money to fund more mental health projects and to do better research so we truly understand, the root cause behind depression, anxiety, and what leads someone to be suicidal.
Dan Egan, Board Chair of the Capital Region Chapter of the American Foundation for Suicide Prevention. Thank you so much for chatting about all this. I know it's not always easy, so thank you.
Yeah, thank you so much for having me. I appreciate it more than you can imagine.
And if you've recently lost someone to suicide, the AFSP has resources to help you process that loss as your life continues. They also pretty regularly host walks and events to raise awareness and funding. We'll link to their website along with this week's show on our website. As always, that's at nynow.org. But the key, experts say, is to ask for help when you need it, whether that's through 988, a trusted loved one, or a mental health professional. There is help out there.